Hello everyone, good day to you. I am Dr. Athira R. I am a head and neck surgeon practicing in Bangalore for the last 13 years. And I do a lot of surgeries, not only for head and neck cancer, a lot of benign, that means non-cancerous condition of the head and neck also I treat. So I am for last 8 years I have been a robotic surgeon, and many people ask me, is a robotic surgery very costly? Can normal people, middle class people or even poor people, can they afford robotic surgery? It is becoming very affordable now, and cost wise I'll be able to tell you from the perspective of a head and neck surgeon. Like I use robotic surgery to treat throat cancers which are involving the tonsils or back of the throat, and also to deal with the thyroid nodules which are in the neck, the lower part of the neck, and sometimes parathyroid lesions. These are the main conditions that we treat robotically. So when we use robotic surgery, we mainly pay for the cost of the instruments, which are separately charged per case. So usually it comes to around 50 to 75,000 rupees, in Indian rupees I'm talking, more than the cost of a regular laparoscopic or an open surgery. So this is not a very unaffordable option. The difference is when we use a robotic surgery. Like if you have a thyroid nodule and it is around 5 to 6 centimeter nodule and you want a surgery, if you're a young unmarried person, you want a surgery where you don't want a neck scar in a benign thyroid nodule, that is a very good option. We can do the thyroidectomy with hidden scars so that there is no cut in the neck, where cut in the neck will advertise to the whole world that you have undergone a surgery, and thereafter then you will be asked many questions related to that. So if you don't want people to know that you have undergone a surgery and you want a cosmetic option, or if your profession demands that you cannot have a scar in the neck, these are the options available. And also we are increasingly, though the robotic started as a cosmetic modality, now or in pelvic cancers or cancers in the prostate and all, and gynecological cancers, because that was the area, the pelvis was the area where it was difficult to reach even using a laparoscope. So the robotic difference between robotic surgery and a laparoscopic surgery, robotic arm has much better rotation. It has 360-degree rotation and different modes of movement. So that was easy to reach into this area, difficult to reach areas like deep throat and under the skin. The maneuverability of instrument is better. So this was the reason for the robotic instrumentation to come up, and these kind of situations it is very good. And this particular kind of surgery reduces though it may be difficult to start the surgery, the initial part, the port placing and attaching the robot to the patient may take a half an hour extra. The surgery is done much faster with better visualization and with better instrumentation and better maneuverability. So this adds to faster recovery of the patient with less scar, and the patient can go home much faster than in open surgery or the kind of surgeries that we used to do earlier. Like earlier when I was a medical student, there was a pancreatic cancer. They used to do a surgery called Whipple surgery, which involved a cut from all through your stomach. There will be a cut, and the patient used to typically stay in the hospital for minimum 3 to 4 weeks. Now with robotics, when we perform the same surgery, patient goes home in 7 days. So that means it is not just for the cosmesis. The patient recovery is faster, the scars are smaller, so the healing is faster. The patient gets back to his normal life faster. So, and it is becoming increasingly affordable as more and more companies are developing this technology, and more and more things are coming to the market. We are finding that the technology will even get cheaper. Like in 50 years back, laparoscopy when it came, it was considered as a new innovation. Like that, who do robotic surgery, we are thinking that in another 20 years, most of the surgeries will start becoming robotic with better results and faster surgery and faster recovery and better outcome all over for the patient.